Hello everyone, welcome back to my YouTube channel Nursing with Piyush. In today's video, we will learn how to read an ECG step by step in a very simple way. This video is especially made for the nursing students and the staff nurses. Let's start Nursing with Piyush. First of all, what is ECG? ECG stands for the electrocardiogram. It is a graphical recording of the electrical activity of the heart. This is a very simple definition we will know. What is the full form of the ECG? Electrocardiogram. In ECG, we will only study and see the graphical recording of the electrical activity of the heart. It's very simple. Okay, I will show you some pictures. In ECG, we will see here the line. I am marking with the blue pen. This side is the P way. This is Q. This is R. This is A segment, and this is T segment. Okay. This is very simple, friends. We will see in ECG the multiple boxes in that the graph. All each graph's boxes is 0.04 second. Each large box has 5 small boxes, which is 0.20 multiply of the 0.04. Okay. I am representing the graph 1 2 3 4 5 1 2 3 4 5. Here we will see the distance is 0.04. I am zooming this. This is the part. Okay, and from this to this, that is 5 boxes, 1 2 3 4 and the 5 last one, that is 5 small boxes. That is 0.20 multiply of 0.04. Okay, normal ECG waveform I already show you. This is the P wave we will finding in the ECG graph. That is Q wave. This is the Q wave. This is the R wave, the long segment. P and R, which represented PR segment, and here is the S and T is ST segment. Okay, and here also we see PR intervals. Here Q and T, Q from this, from here to here. What is P wave? I will explain you. ECG waves explanation. We will study here QRS wave. Here is the QRS wave. It's very simple, my friends. I will tell you all these waves name. P wave. P wave represent arterial depolarization. I will deeply tell you what the arterial depolarizations, what is ventricular depolarization. I will tell you all the things, so don't worry. It shows that the arteria are contracting. The heart is pumping. When the artery is pumping, that shows the P wave. It shows that arteria are contracting. Normal P wave smooth before every QRS. Smooth before every QRS. Okay, let's talk about QRS complex. QRS. Okay, QRS complex represent ventricular depolarization. It shows ventricles contract. Okay, I will here to write this. QRS complex represent ventricular depolarization. I'm sorry for these mistakes of this spelling. DEPOLARIZATION. Okay, sorry for this. Sometimes we all escape these all the words mistakes. We are also human means, so never mind. It shows ventricular contraction. I already tell you that ventricular contraction. Normal QRS duration. We will talk about what is the normal QRS duration. QRS normal duration. Okay, if less than 0.12 second, if less than 0.3, a small, I'm sorry for this, not the 0.3, it's only the 3 small boxes. I will tell you already what is the small boxes. In a particular graph we will line up the 5 small boxes that form 0.20. If one boxes contain one line, that is 0.04. Okay, now we talk about the T wave. What is the T wave? T wave represents the ventricular repolarization. It shows the relaxation of the ventricle. When the ventricle relax, when the pump of the oxygen into the artery, then valves are easily passed through the blood and closed. That's from the T wave. Here we will write this T wave. T wave represent ventricular repolarization. It show relaxations of the ventricle. Okay, now maybe step by step ECG reading in important parts. First, the heart rate. This is the common reading about the ECG. I will repeat this. What is ECG? ECG stands for the electrocardiogram. It is a graphical reading of the electrical activity of the heart. Here I will show from the pictures. There are waves, that is P wave, Q wave, R wave, S wave and T wave. These are the waves we will find in the ECG. Okay, now step by step reading ECG. Most important part. First step. I will highlight from red pens. Steps. Okay. First step we will read about the heart rate. First we calculate the heart rate. Okay. Heart rate is equal to 300 divided by the number of the large boxes between the two R wave. Okay. I will write this. Heart rate 300 divided by number of the large boxes between two R waves. Okay. Here I will show 1 boxes, 2 boxes, 3 boxes and the 4 boxes. Okay. Here is the 1 R and here is the 1 R. Okay, now 300 divided is to 4 is equal to 75. It is very simple. 75 beat per minute. So normal heart rate, we will write here the short form of the heart rate, 60 to 100 BPM. Now we will study about the rhythm in second step. Second to rhythm. What is rhythm? Equal the R wave and the R wave the distance, that is irregular. If unequal, this is irregular. Okay. Rhythm, that is these are the rhythm that represented in the electrocardiogram graph. Now check the rhythm. Check the rhythm. Okay. Equally R and R distance. If there is shown in the normally, that is regular. If unequal, R and R distance, that is irregular. Now we check P wave, step 3. Checking P wave. P wave present 1 P wave before each QRS. One P before each QRS. If there is no P wave, that is called atrial fibrillation. If you don't see any P wave, that is atrial fibrillation. I am highlighting this. If you can't finding any P wave in the graph, that is called atrial fibrillation. Now PR intervals. Step 4. PR. Here is the boxes, the distance from the P and Q. Normal PR interval, that is 0.12 to 0.20 in second. That means 3 to 5 small box. That means 3 to 5 small boxes. I'm already telling you the distance of the one boxes, which included the 5 boxes in one boxes. If the PR is long, the first degree hard block, I will tell you all about that. If long PR, then it's first degree hard block. Now QRS duration, we will study about that. Step 5. I am telling you guys, if you all read very carefully all these steps, you will easily find what the complications with the patients when seeing the graphs of the electrocardiogram, that is ECG. QRS, that is the very basic and the simple I will telling you. If you carefully notice what I am saying to you, what I am telling to you, what I teach to you, that is very simple form. Normally QRS duration is less than 0.12 second. Okay, now narrowing of the QRS. If the QRS is narrow, just suppose that is, if this is, the distance is narrow, that the QRS is complication. Okay, narrow QRS. Okay, here supraventricular rhythm. If the QRS is narrow, we will we our mind notice that it is the supraventricular rhythm. If the QRS is wide, ventricular rhythm. Supraventricular rhythm. In wide QRS, we will notice it is ventricular rhythm. Now we will talk about the NSR. What is NSR? NSR is normal sinus rhythm. NSR, normal sinus rhythm. Okay. If all 5 steps are normally, it is called the normal sinus rhythm. Okay, steps are normal, it is called normal sinus. I'm sorry, normal rhythm. Okay, firstly what we all are study in previous: heart rate, rhythm, waves, intervals, duration. Here we will all repeat again. Okay, first rate 60 to 100, rhythm that is irregular. I'm sorry, this is the happened. I'm all long pressing that. P wave, present, PR, normal, QRS, narrow. If the QRS is narrow, then that is called the normal rhythm. Common ECG rhythms. We will sort in the what is. We will study about sinus bradycardia, sinus tachycardia, arterial fibrillation, ventricular tachycardia, ventricular fibrillation. These all are we will talk about. Okay. Always check the patient first, not only the ECG. We will find the loose lead can cause the false ECG, and that is called ventricular tachycardia, ventricular fibrillation, or the emergency rhythm. Okay, now here we will talk about the common ECG rhythm. Okay, this is very long video, so never mind. Firstly, we will study about what is the ECG, that is called taking 10 to 15 minutes. Common ECG rhythm. Okay, we will say the ECG. We will notice what the patient's cause, that is bradycardia. Bradycardia means the heart rate is less than 60 beat per minute. Bradycardia. Bradycardia. Sinus tachycardia. Tachycardia in the sense the heartbeat is more than 100. Tachycardia. And then we come up in atrial fibrillation. Atrial fibrillation, if you notice there is no P wave and irregular rhythm, this is the risk of the stroke. Atrial fibrillation. I'm wrote all this. Ventricular tachycardia. Ventricular fibrillation. This is the basic common we will finding in the ECG graph. Okay, I'm here. All these are wrote, so don't worry. Bradycardia, sinus bradycardia, heart rate is less 60 beat per minute. Tachycardia, heart rate is more than 100 beat per minute. Atrial fibrillation. If you notice no P wave, the patient, and you notice irregular rhythm, your patient is the risk of the stroke. What is the ventricular tachycardia? Tachycardia means the fast rhythm with the wide QRS. Fast rhythm with the wide QRS. fibrillation, there is clear waveform. Patient is the cardiac arrest. If you notice the clear, sorry, no clear, sorry, no clear waves. You notice there is no clear waves form. That is called the atrial fibrillation. Okay. I am already here putting some ECG. So don't worry, I will telling all. Already I am telling which types of the rhythm. Here you will notice there is how many boxes in there in each graph. 1 2 3 4. Here to here 0.04, and here to here 0.20. Here I will wrote all this. This is P wave, this is Q. Wait a minute, it's my mistake, sorry. Okay, now you see here is the P wave. Here you notice the Q wave. Here you notice the long segment, that is R wave. Here it's come, that is S wave. Here is again gone, that is T wave. So you will notice here everything is working like it should. That is the normal sinus rhythm. This is the normal sinus rhythm. Here also 1 2 3 4, 1 2 3 4, 1 2 3 4, 1 2 3 4. Okay, all these have the graphs 1 2 3 4 5. Each boxes contain the 5 boxes each. What we not seen in this rhythm, that is normal rhythm, sinus rhythm. Okay, now see here, what is this? This is we saying the regular ECG complication, that is 1 2 3 1 2 1 2 3 1 2 1 2 1 2 3 1 2. This is the regular graph we will notice. What we will see in this graph, we will see in the sinus tachycardia. Good. This is pumping. We are seeing the pumping too fast. There is no gap between these. Each graphs contain 0.20. Too fast but regular. Okay, here what you notice, 1 2 3 4 5 6, 1 2 3 4 5 6, 1 2 3 4 5 6. Here what we notice, 1 2 3, again 1 2 3, again 1 2. That is called sinus bradycardia. Pumping is too slow. P wave here, T wave here. There is the wide. There is also wide. This is called slow pumping of the blood. That is called sinus bradycardia. In sinus bradycardia, we notice the heart rate is less than 60 beat per minute. In tachycardia, we will notice the pumping of the heart is more than 100 beat per minute. Okay, that is so too slow. Okay, what you notice here, this graph, Good. That is arterial fibrillation. Arteria are the quivering. Okay. I'm sorry. Arterial fibrillation. Now, what you notice here? So, tooth appearance. If you notice, tooth like a structure, a small tooth like that is in the wave form, that is called arterial flutter. You will questions me, sir, if there is no T wave form, so what is this form? That is regular wave like a structure. Here the T wave, here the QT. That is called ventricular fibrillation. Verticals are the covering. Okay, so don't worry. I will telling you all these name of this graph. Also, I am posting this page in the my Telegram, Nursing with Piyush. Piyush, in that the form name is capital. Okay, ventricular fibrillation. Now you tell me, guys, what is this? Here the long regular wave. If you notice, if there is too fast, that is called tachycardia. So which type of tachycardia is the form of the wave? That is called ventricular tachycardia. Ventricular tachycardia. If you notice, these like a structures in the electric graph and a small wide, small, wide, small, wide, small. What we call torced D point. Visiting appearance types of the wave. I will tell you the first degree head blockage, second degree head blockage in the earlier. Okay, now tell me which type of the graph shown. Here the P wave, huge wide, again Q, again R, again S, again and T. क्या रुकिए अभी पढ़ रहे हैं ना. If the PR intervals containing more than 20 0.04 20 seconds, that is regular, that is called first degree heart block. H for heart. Okay, now if you notice, how many boxes? 1 2 3 4 5. Again here 20. Now repeat. 1 2 3 4 5 6. If you notice, the lengthening of the PR intervals with the drops of the QRS complex, that is called second degree heart block. It's very simple, guys. I will tell you all now. If you notice, P wave, here is the P wave. If you notice, P wave has no relationship with the QRS. There is no relationship with the QRS. QRS you will not notice. That is called third degree This is the very emergency. If you notice this graph, 3rd degree heart block, you will document this and call for your doctor. Okay, this is plain graph. If you notice, that is called S-stop. There is at a standstill a start CPR. If you notice, there is plain graph you are noticing in patients in your 5 para monitor and ECG. You will start CPR, but the ALS form. What is the ALS? Advanced life secure. Okay, A for firstly you will safety the patient. Second, tapping the patient, calling them, are you okay? If you not respond, check for the pulses, then call for a activate blue code, then call for your help, then start CPR in the 30:2 ratio. Okay, ace stall. Here, no pulse, unresponsive, no breathing. That is called pulseless electrical activity. Pulseless electrical activity. I am telling you the huge word point. Always check the patient first, not only the ECG. If you think the loose of the lead cause of the false ECG, it is prevent tachycardia, ventricular tachycardia, fibrillation. That are the emergency rhythm. Okay. Here all these I will post it in my Telegram. You will check in my Telegram. And this is the small video of the ECG. I hope you all know about the ECG very good way. That's all for today. If you like this video, please like, subscribe and share this to the Nursing with Piyush. Thank you so much.